Betty Ballard, and I'm 69 years old. When I was 16 years old, I was in a car accident, in traction for 2 months. When he set my leg, that leg was 1.5 inches shorter than the other leg. Most people's knees are like this, but mine became like this, which caused me to limp all my life. My back was curved. My hips were very slanted. The pain was awful. It was awful. I finally just sat down and said, enough's enough. I've had it. I'm going to go do something about it.
I'm Michael Wind. I'm an orthopedic surgeon here at our Johnston-Willis office with Ortho Virginia. The orthopedic service line at Johnston-Willis is a diverse line. We cover most orthopedic specialties, anywhere from joint replacement to hand surgery to spine surgery. The most common procedure I do is hip and knee replacement. Total knee is one of the best procedures in all of medicine. It's treating people with knee arthritis, degenerative knee arthritis primarily. It can be, quote, wear and tear over time, or post-traumatic arthritis or rheumatoid arthritis. Ms. Ballard came to see me after struggling with her knee for a prolonged period of time. She had a trauma as a young adult, which left her with a deformity. Essentially, her knee pointed in at a pretty acute angle and had resulted in severe degenerative change in the outside part of her knee. We looked at her x-rays and planned out the surgery looking at the entire length of her leg, and I felt like we could do the surgery through a single approach.
I said, I only want one surgery if I can help it. He said, that's all I want to do. I said, you gonna do it? He said, yes. He said, I'm gonna try to make your leg straight, and I'm gonna try to lengthen a little bit, and I'm gonna give you a new knee.
Total knee basically resurfaces the femoral and tibial surfaces of the knee. So we take off just a little bit of bone to remove the arthritic bone and to allow for a cap or prosthesis to be placed on the femur, and then another cap or prosthesis to be placed on the tibia with a plastic spacer in between. And that's what forms a total knee.
He was saying all these medical terms that meant nothing to me. Honey, I was sitting there on that table so excited, said, you can talk all you want to, honey, we're gonna get this thing done.
We performed left total knee replacement using a posterior stabilized implant.
Dr. Wind performed my surgery at Johnston-Willis Hospital. I love those people. I remember when I got out of surgery, my husband, he looked at me and he said, I never dreamed he would get your leg as straight as it is.
Ms. Ballard did excellent with her surgery. She was able to walk in an improved fashion really within a week or two of surgery. So she was up doing very well relatively quickly.
Oh, life is wonderful now. It's so nice to be able to walk around. I don't have to lean on my husband. It got to the point that whenever I would walk, he was my crutch.
She has already seen remarkable improvements in her quality of life as far as activities of daily living. Her knee replacement's been functioning well now for a couple years.
I can get up and walk just as well as you can. I can go visit my children. I can go out to eat tonight with my kids. Love it. I can be like you are. I have no regrets, no complaints. For years, I could not walk on the beach. I can walk on the beach now. I can now do things that I could never do. I couldn't have done until after I had the surgery.